when people say detox, what they really mean is managing alcohol withdrawal syndrome. Okay. And so the easiest, if you could control your drinking, probably the easiest way to do it is to simply cut your drinking in half every day for, until you're off. Right. Well, doctor, that's great. If people could do that, they would not need you, would they? Right. We'd be kind of done here. People could actually, easily taper them down from 10 drinks a day to 5 to 3 to 2 to 1, right, over a week. We would have no problems. We really would have, that would be anyone could do it. So there are a number of ways so assuming you can't do that, right, or it's not very easy. And if you did that, by the way, if you did this slow taper, the risk of serious complications is much lower. Okay. There are a whole series of ways medications that can be used to manage alcohol withdrawal syndrome that most physicians are familiar with. The most commonly prescribed are actually ones that we kind of don't recommend anymore for first line treatment, but they go back a long way in history. And these are the benzodiazepines. These are like Valium, Librium, Ativan. There's a whole list of them that have, and they all end in PAM, right? Clonazepam, diazepam, right? The generic name. So you can see if you've been prescribed one of those or not. So by knowing what the last few letters of the word are, of the drug name are. But there's a bunch of other medicines that can help you come down and not experience any of those complications that we talked about, like, having shakes, tremors, sweats, nausea, vomiting, diarrhea, let you sleep. Several medicines are really quite effective at doing that are not dangerous or habit forming, right? And Ria, we prefer gabapentin, but there's some arguments for a medication called baclofen, some arguments for other anti-epileptics, oxcarbazepine, right? There are choices here that are not in the benzodiazepine family. But unfortunately, as I said, most physicians today are not as clued up on that as they should be, because they're the treatments that were used when they were in training were exclusively benzodiazepines in hospital. Abrupt cessation versus slowly tapering is another really great question. There's actually not a lot of medical literature on this, but it's logical that if you taper your alcohol use, right, don't just stop all at once, the withdrawal severity will be less. Okay. And so if you don't have a supervised setting and you have one of the medications we use, we would recommend a progressive decrease in amount of drinking plus medications to get people over the initial unpleasant symptoms. Alcohol withdrawal syndrome can be fatal through delirium tremens, uncommon, but can occur. In contrast, opiate withdrawal syndrome is never fatal, right? The withdrawal itself is really unpleasant, but it never kills you, right? So, and the same with nicotine withdrawal, right? There are medications to help manage it, and expert physicians would be my recommendation for who to go to. Someone who actually manages alcohol withdrawal syndrome on a regular basis would be the person who would be your best advocate. We've been managing very well with it. We're instituting some new protocols to actually test which systems work best in our patients. And I think this is an area where there is a transformation beginning in medicine about managing alcohol, and part of it is not so many detox facilities have no medical supervision, right? They basically, are very supportive. They're wonderful people, but they might give people an antihistamine, right? And for sedating effects, and a cot, right? And just let them suffer through it. Again, most people won't die from withdrawal syndromes, and if you can, jail does no treatment at all, right? So if you crash your car and you've been drinking 10 beers a day, and they take you and put you in jail, you'll have alcohol withdrawal syndrome, and Most of the time you'll come through with just, like nothing more than a really unpleasant experience, that even more unpleasant than just jail by itself. But in our view, is that tapering the alcohol dose coupled with effective medication is probably the safest and most effective method to decrease your alcohol consumption from a higher amount to a safer amount. The challenge, of course, becomes maintaining that safer amount or getting all the way off. I mean, it's not like it's going to be easy, but there are things you can do to maintain the progress of decreasing your consumption. And again, it's always called detox, but it's only really toxic if you stop all the drinking right away and don't treat it.
For expert support on medication-assisted treatment for alcohol use disorder, visit riahealth.com.